Gurur Brahma, Gurur Vishnu, Gurudevo Maheshwara, Guru Sakshat Parabrahma Tasmai Shri Guruve Namaha. With utmost humility, I prayerfully bow before the lotus feet of our beloved Mother Sai. Brothers and sisters, Sai Ram to all of you. I thank Mano, Hridaya Sai for giving me this opportunity to share my life's journey as a student, as a doctor, and as a human being on the spiritual path at the lotus feet of our beloved Bhagavan. I will start this story from 1968. This was the time when Swami toured the North Karnataka states, and he made a visit to Hubli, and that was where my father, who was a professor of pharmacology, was working in Karnataka Medical College, Hubli. So at the time when Swami visited, and I was just an infant and being carried by my mother, and one among the many devotees who were lined up to have Swami's darshan. And my mother recounts how as Swami passed us, he very sweetly smiled at us, and she heard him say that this child will come to me one day. So she was quite perplexed and quite surprised at this remark. And our life went on, and the full import of these words were only evident when in 1987 I had the good fortune to become a member of Dr. Shekhar Rao's family, and a very beautiful smiling picture of Swami welcomed me into their home, and so began our close physical proximity to Bhagavan. So in 1991, I completed my medical degree, and then I had taken a break for our children. They were small, so I was at home, and I was a little concerned about my own future, of how I'm going to ever start pursuing my career. All my friends and colleagues had all got into other post-graduation courses, and I was here babysitting and not doing anything. So there were a few moments of low in my life at that time. And I remember at one moment when I was with the two children, both very small at that time. They were just 1 year apart. And I just sent out a very silent prayer, but a very intense prayer to Swami, saying, Swami, please take me from this place and give me some, take me to Puttaparthi, and maybe I'll be able to do some post-graduation there, and the children will be able to study in that school. So that was a very intense prayer that I sent out, and very surprisingly, a short time later, Dr. Shekhar had the very good opportunity to come and work in Prashanthi Nilayam as a cardiac surgeon. That was in 1994, and that was the beginning of our journey at Bhagavan's lotus feet. So in 94, when I came, I was still at home, not doing anything. And when Swami called us for an interview, the first thing he told me, he addressed me very lovingly, was, I know you are very keen to restart your studies, but now it is your duty for 2 years to look after the children. That was such a beautiful and reassuring message for me, because at a time when I was not sure of how I'm going to start my post-graduation and how life is going to turn out, it was such a reassuring thing that Swami had himself told in his own sweet words that 2 years it's your duty, and then you will have a chance. So it was a very beautiful message by Bhagavan that he himself had told that 2 years is a timeline for me. So very happily I stayed back 2 years, I did my duty, looked after the children, and as he said, in 1996, I got a chance to start working in the Department of Ophthalmology at Prashanthi Nilayam. I started as a registrar, and there was no formal training at that time. And at that time, the diplomate of the National Board exams had a certain rule. We had to take the primary exam, and 8 years later take the second exam, within which we had to complete 3 years of our training in a recognized DNB institution. And the first part of DNB I had taken in 1992 February. So I had time to take the second exam, the final exam in up to February 2000. So I had to latest start my training by 1997. So this was in 1996 when I joined the department. There was no signs of any training at that time. So I just started, and I hope that DNB will start and I will still be able to make use of my first part exam that I had taken. But 97 came, months rolled by up to June, and nothing seemed to be happening. I was a little disappointed that probably I will not be able to make use of my primary DNB. But sometime in I think May end or June, there was a team from Delhi, the national board team, who visited, and they did recognize ophthalmology as a DNB training institute. That was from July 1997 officially. So though I was very happy, I was also concerned that probably it may not work out for me because I may be short, because DNB itself is a 3-year course. But I did start, and I became the first student of DNB ophthalmology there, and I think I'm extremely fortunate, and I think it is a punyam of many generations that I got this opportunity to be a student in Swami's institution. Because apart from ophthalmology and the subject itself, what Swami taught us was something very great and very profound, and we just had to keep our mind open to all the grace that he was showering on us throughout. So I started my training, and I must say that though I was the first student and there was no particular curriculum already established, the training went on in a very beautiful way, and it was complete in every respect, whether it was patient care, whether it was the academics, and we had a very beautiful library, and I think we had access to most of the recent journals. All the best books had been donated, and we had very good clinical material for us to learn. So the training was very good, and we had a very good set of doctors, very good human beings there. The department was headed by Dr. Khosla, and we had Dr. Lakshmi Narayan, Dr. Prasad, and Dr. Gopal Krishna, Dr. Pupal Raja, all very dedicated individuals, very good souls. So they guided me very well, and my training started with all earnest. And during the training also, I would always like the way, before starting our operating schedule, we used to have a combined bhajan. All the sisters and doctors would gather, would have a bhajan, and we would start the day's surgeries. And in between, the dome was just next to the ophthalmology department in Prashanthi Nilayam. So we would have prayers, afternoon prayers. So the whole environment was charged with such a beautiful and prayerful atmosphere that it was a very beautiful experience to work there and to see patients. And just like we take the Hippocrates oath of the physicians as we start our medical career, I think being in Swami's institution, we are able to practice medicine in its absolutely true spirit of how medicine should be. There is no other concern but the patient's care and the patient's problems, and we are not thinking of any other aspect. And the kind of healing atmosphere that the patient has as a patient walks in, it itself is quite a profound thing. So the training went on, and of course apart from the training we had very blissful moments. We would go for regular bhajans and darshans, and very nicely Swami would call all the doctors, and during major events like his birthday he would always distribute clothes, talk to us. So beautiful, Swami would just walk among us. And two instances I remember here is every birthday time he would call all the doctors and give us clothes, and it was always a very exciting time for us. There would be an announcement, the Swami has started giving some clothes, and we would all rush there. And more than receiving anything from him, it was the proximity that Swami would come there, talk to us, smile at us, and he would just be joyfully among us. That was such a beautiful experience. And one day, when one such announcement, Swami said that they're giving saris, and we all went. And I remember, it was Swami walked among all of us, and he had a bundle of bright colored saris. They were all very bright pinks and bright reds and all that. So we were all wondering. And then as he was walking down the line, just four ladies sitting next to me, and then I just saw, and I kind of counted. Okay, the fourth saree is a bright red one. Maybe I don't like red so much. I am not very keen, and I don't wear red. Is he going to give me a red one? Am I really going to get that red saree? And he gently came, he gave the thing, and the next was the red saree, of course. So he paused, he looked at me, very smiling, and he just waited for some time, and I was wondering what is happening, what is Swami thinking. And then he gently goes down the pile, picks up a blue saree and gives it to me. And brothers and sisters, this is the saree I am wearing now. So Swami had read my mind. He knew that I didn't want a red one, and he gave a blue one. It was such a beautiful thought that, he just knew what I was thinking. And on another occasion, I think another year later, when Swami was again giving saris, and we were all supposed to be there in the front row, and a few of us, of course, got held up in the OPD. We were a little late, so I think 3 or 4 of us went a little late. So we had to squeeze in, there was hardly any place. So as the ladies were sitting, and I kind of was a little behind, because I couldn't really, there was no place to squeeze in right to the front. And of course the concern was Swami might miss me and I might not get a sari. So those things, the thoughts were coming in my mind, and Swami gently was walking and he was tossing a sari to everyone's lap, and it was, as we have seen Swami, his aim is so beautiful, it just lands on anybody's lap. So he was giving the saris, and sure shot, as I had thought and as I had worried, he missed me. And he went past, and it was such a deep sense of disappointment that, oh God, Swami has missed me, and I really missed a chance to take something from his hands. And he went, three ladies he gave, and then he took a sari, turned around and just tossed it directly to me. And it came, I was a little behind, but it came to me, and it was, I still feel so, happy to think of those moments. So we had such very beautiful moments during our course. It was not just our studies, but all these lovely moments we had with Swami. Swami would walk among us. And another occasion, when he was distributing some hair bands and things, he gave it to me and he said, "No daughter, nuve vesko." It was such a beautiful feeling. So all these lovely moments we had with Swami. So my training was completing in a very nice way, and my exams, we were supposed to take the exams in June of 2000, and then I got a letter from the DNB board saying that I am short by just 2.5, I had completed 2.5 years, so I will not be able to take the exam earlier, and probably I'll have to repeat the part 1 again. It was quite a downer for me at that moment, because that meant that I had to retake the entire subject again, starting from anatomy, which was a little difficult at that time. But as usual, a silent prayer went to Swami. I said, "Swami, I have come, you have, brought me all this far, and I finished my training. Now it's up to you. Please help me with this, because there is no way I can, retake it. Almost is impossible." And this is exactly, Swami gives us these situations and teaches us what Sharanagati is and how we should just surrender, and how beautifully he will help us. So with Swami, he just shows us that the impossible is truly possible. So a couple of letters were written, exchanged between the DNB board and me, and as a very special grace, they allowed me to take the exam in 2.5 years in January of 2000, which was probably one of its kind in the history of DNB. So I finished the course in 2.5 years, though of course I worked in the department for longer, but on paper it was 2.5 years. So I took the exam, And at that time, of course, I was managing the family, children, so I was wondering where I would have to go for the exam. And my exam, when I got my hall ticket, I was very pleasantly surprised. It was at St. John's Medical College, which was literally next door to my house in Bangalore. So very conveniently, I finished the exam. And after that, there is usually a gap between the theory and the practical. So I thought, okay, let me just go and visit another hospital, or just go and interact with other students, because since I was the first student in the ophthalmology department, whether I'm on par with how, for the training for the practicals. So all these things were going through my mind. And the head of the department suggested that I go to Sarojini Devi Eye Hospital, which was in Hyderabad. And I was wondering how to go about it, because it was the time before the email and before the cell phone and all that. So we had to get the address and actually write to them and find out. So before I could even work on it, within a week, we had the superintendent of Sarojini Devi Eye Hospital herself visiting us. And when I entered the OPD on that one morning, our head of the department, Dr. Gopal Krishna, said, Kavitha, come, let me introduce you to Dr. Sita Lakshmi. She was the superintendent. So it was a very pleasant surprise, and she hand took my application form, and she made all arrangements for my stay and for my stint there for 1 month. So it was a very beautiful and very easily it happened. And so the period was fixed between February 15th and March 15th, and everything was ready and the accommodation was ready. And the children at that time our children were studying in the primary school, and Swami, there was news, and we heard from the school also that we should all get prepared, and Swami will be conducting the Upanayanam ceremony for boys during that time. And the dates that were kind of given to us, tentative dates, was around February 20th. So it was definitely disappointing for me, because my program had was fixed up for the 15th, and I had to leave before that, and it was very disappointing that I couldn't stay for my own children's Upanayanam ceremony. I think Swami, as usual, heard my prayer, a mother's intense prayer at that time. So it was really a very a very happy moment when it was announced in the morning darshan that Swami is conducting the Upanayanam on 10th of February in 2000. So it was such a happy moment, because it was beautifully timed. I could participate in the Upanayanam, and completely, involve in all the beautiful programs that were planned for that time, and then leave for my program at Sarojini Devi Eye Hospital. So February 10th was it was a very beautiful occasion, and for that Upanayanam ceremony, we had my mother-in-law and my mother-in-law's elder sister, a very devout and pious and very nice lady, who also came for the Upanayanam, and she was there. And because I had to leave Dr. Shekhar for 1 month, they all stayed with them, looked after him, and they thought they can enjoy Swami's darshan at that time. So that was the plan. And my mother-in-law's elder sister and her husband had had Swami's darshan, I think, way back in 1960. They used to, once in Madras, when they had darshan, that was maybe around 1960, and Swami had called her husband for an interview, and she almost got up to go. Swami said, I'll call you later. So then, of course, so many years passed by, and of course when she visited, she came for the Upanayanam ceremony. And at that time, one morning, Swami actually called her for an interview. And he told her, see, I told you I'll call you. So the Kalatita that Swami is, 40 years later, he kept up his word and called her for an interview. It was such a beautiful thing to hear from her own words. So the Upanayanam ceremony went on, and then I left for the hospital. And when I went there, of course the accommodation was there, and I felt that I was extremely lonely, because I was just staying alone in the room, and I was wondering how I'm going to stay for 1 month this way. But within just 2 days, one devotee of Bhagavan called me and she made me stay in her house. She invited me and I completely stayed for 1 whole month in her house. And it was very beautiful because she told me very nice stories, her experiences with Swami, and she used to take me for Thursday bhajans and we used to have satsangs. So it was very, very beautiful. Swami made the experience so wonderful. Apart from the training, I had this spiritual experience also. And when I went, actually, I didn't know anybody there, and one of the girls who was also a student, she asked me, can I ask you a question frankly, why did you even come here? Because we don't have many classes going on, and why did you even choose to come here for a training? So I was wondering, oh my God, did I, what was the decision? Is it okay? But then I thought that if there's nothing that happens without Swami's wish, and if I have come here, there must be a reason. So let us leave it to Swami. And the next day, the surprising thing, and it was surprising for all of the students also there, that the whole roster for the 1 month was put up, and the classes were all scheduled for a whole month. And we had a beautiful training for a month. So they were all joking that I think you have brought us some luck. But I knew where the luck came from. It was nothing but Swami's plan and the training that he gave us in that form. So we had a very good training, and 2-3 occasions I felt Swami was very much there with us. On an instance when one day, I had a class at 8 o'clock and I started by around 7:15 from the home. And usually I would take an auto, but then I realized suddenly there was a strike on Band on that day, and there were no buses, no autos, nothing. And I didn't even know the way to walk and go there. I was just walking across wondering what to do. And suddenly there was only a single auto which came. And he stopped in front of me, and I was wondering, my God, is it okay? Is it? And then I got into it, and surprisingly I saw Swami's picture in that auto. I was really surprised. I was so dumbstruck that I realized that I didn't even tell him where I wanted to go. And he went and he stopped near Sarojini Devi Eye Hospital. I got down and then I asked him, how much should I give, because it is a Band time and I thought probably they'll take twice or thrice the amount or something. And he said, no ma, I don't want anything, and he went away. And later on I realized, oh, did I even tell him that I had to come to Sarojini Devi Eye Hospital? So some of these things even bring goosebumps to me even now at this time. So I really felt Swami's presence with me throughout the whole period. So I finished this training. It was a very nice thing, and by March 15th I came back to Parthi. And that was the time children had to come back from school. So I said, okay, now I have finished my exam, my theory exam and my training. Now I'm going to take a full break. I'm going to keep my books away. I'm going to spend my time with the children. And so I did that. The children came, and I'm very happily with the children. And I thought the practical exam is sometime in September. I still have time. I am not going to study for some time now. And suddenly out of the blue I get a telegram on the 19th of April. Says, passed report for practical exam on 26th April at Lyco Aravind Eye Hospital, that is Lions Aravind International Center for Community Ophthalmology. I was so shocked that just 7 days more, and I had just kept my books away. I thought I'm just going to take a complete break, and I had done my thesis. Everything was complete, the work was complete, but it was not compiled. Everything was in sheets of paper, and something had to be typed also and had to be printed. And that was the time before the digital era. We had taken slide pictures of the photographs of the eye. All that was just in everything was scattered, and I had not compiled and I had not arranged. And apart from that, I was suddenly concerned because, I had to, this was a full practical exam with case presentations and instruments and everything. My God, was I even ready for it? This is how Swami works. He gives us these kind of situations, and then he says, okay, surrender to me, and now you see how beautifully I will handle this. So it is one such experience. And I clamored, actually collected all the things, and we had our one of Swami's students, Mr. Ramarao, who was in the ophthalmology department at that time. He helped me. We tried to put everything together, and then Dr. Shekhar also went to the to book a ticket to Madurai. We had to, because we're not sure whether we're going to get any tickets at such short notice. And that was we went to the Puttaparthi bus stand. Actually, that was where there was a counter for railway bookings from Bangalore and all that. So when we went there, they said, no, I think it is all full. We will not get tickets at such short notice. And we just came away a little bit, and we were talking. We were wondering what to do. Should we take a taxi? What should we do? And then he called us back saying, I think there are 2 tickets. Will you take it? And they're exactly what we wanted, 2 tickets from Bangalore to Madurai. So we booked the ticket, we got the tickets, and we came. And that was when Swami was in Whitefield at that time, Vrindavan. So we collected. In fact, I had all my the thesis. Actually, it was not even bound. It was all in papers. And normally the rule is that we have to submit the thesis to the DNB board. They have to actually go through it, correct it, approve of it, and then only we can go and appear for the practical exam. But because they themselves had announced it so late, and it was just 7 days, they gave me the option of, they gave me the rule. They told that I could just take my thesis with me to the examination. So I got all the papers, and we came to Bangalore. We drove straight to Whitefield because we thought we'll have Swami's darshan at that time. And when we arrived there, I clearly remember it was and before that, yes, and I also had to get the thesis signed by my guide. And that was another beautiful thing, because actually when the time came for the signature, I realized that our head of the department had actually left on long leave, because it was the summer time and they were all going for their leave. And our head of the department and my guide was not even in Puttaparthi. It was such a, it was a real shock, because without the signature, the thesis is not valid. So I actually, he usually used to visit either Ahmedabad or Kurnool, where his sons used to stay. So I called up his son in Kurnool and asked him that, I need an urgent signature from doctor. Is he there? And he says, no, he has gone to Ahmedabad. And I just don't have time. I just have like 2 days to leave, and there was without signature. What can I do? So it was a real panic situation for me, and as usual, I just placed it totally in Swami's hands. I said, Swami, you have brought me all this way. Now I need the signature. Please do something. And the next day, his son called me back saying that actually he's coming for an urgent work back to Kurnool. You can send the paper over here. So it was so surprising. I actually sent one of our staff who was working in the hospital. I asked him to go and get the signature, and I had not got everything ready, so I just sent the first page where only his signature was required. So this gentleman took it to Kurnool, and actually on the way his bus broke down, and he also reached late. His help came from somewhere, and finally he got the signature and he came back. So it was absolute last moment. And so finally we reached Bangalore, and we went to Vrindavan for Swami's darshan. And at that time, by the time we reached, everyone was seated and there was a total silence, the hush, before actually Swami comes out for darshan, absolutely quiet. So somewhere quietly I just went and sat at the back thinking that I'll just have darshan here and that's it. And somebody, some of the staff, they recognized me and they said, Madam, why don't you come? And that's how I just slowly, they somehow got propelled, and there was just absolutely one seat in front of Swami's chair, and that absolute one seat, as though it was kept for me, I went and I was seated there, and it was one of the most beautiful darshans I had. It was, it's a time when I actually experienced the Sharanagati, or the total surrender that, I had in my mind. I said, Swami, I just have everything like this in this kind of a thing. You must help me, be with me. And after the darshan on that day, Dr. Shekhar had gone in, and then he had an opportunity inside Trai to tell Swami, Swami, we are going to Arvind for my wife's exam. And he told, Tumba Santosha, tell her I will be with her. So that was the most reassuring thing that Swami had told, and I truly felt his presence throughout the exam. And that was a time when Arvind Eye Hospital had actually been recognized for an FRCS as an FRCS exam center. So they wanted to conduct the national board exam exactly on those lines, so that it will be like a trial run for them. So it was a very beautifully and very elaborate exam, starting from 7 a.m. to 7 p.m., complete with short cases and audio visual and our viva and of course our thesis discussion. And the whole thing just went about so well. Everything was over and I completed the exam and came back. And after that, of course, it was a very a big relief that everything was over. And it was, and I knew that primary DNB is a very tough exam and it's very difficult. The pass rates are very low. Much later, when the results came, out of 29 candidates who took the exam on that particular day, only 10 had made it. And the first candidate from Satyasai Institute of Higher Medical Sciences, Prashanthi Nilayam, had cleared well. So that is truly, I think, Swami's doing and Swami's grace that I could, go through this easily. So having completed my exam, I joined the department as a senior registrar and I continued there. And then in 2001, when the Whitefield hospital came up, Swami sent Dr. Shekhar here as a cardiac surgeon. And at that time, we had an opportunity to ask Swami whether I will also get a chance to work at the general hospital here. But Swami thought for some time at that time and said, "But alli retina ilvala," he asked. He told. So it was as though Swami had already made me a retinal surgeon. That means he had the plans laid out for me that this is the work that you have to do. That was before I even came into this specialization. So I continued there. The children were still studying there. I continued for another year. And then we all moved to Bangalore when Swami gave us the permission to come to Bangalore. And then I started to train. I joined a fellowship training in the Retina Institute of Karnataka, and I did my retina training there, and I continued working there. And I was waiting for Swami's next call and the opportunity to serve in Swami's hospital. And in 2018, Swami gave me an opportunity to come as a visiting consultant to the Department of Ophthalmology here. I would come once a week. At that time, Dr. Shekhar also was involved. He was coming, was visiting. So I was also very keen to come with him and serve in Swami's hospital. And a couple of instances I would like to narrate here at the time when I was a visiting consultant, and we would see patients, we would do surgeries on a single day, and we have by Bhagwan's grace a very beautiful high-tech vitrectomy machine had been installed in our hospital here. So we were able to perform the latest through the latest technique our vitrectomy surgeries. So we were operating, and I remember one of the patients who was a very sick patient who had multiple comorbidities and had a very advanced diabetic eye disease, which we call as a traction retinal detachment, and this he had in both his eyes, and he was actually a fruit seller somewhere on the Bangalore-Mysore road, and he was financially in a very, very poor situation with both his eyes affected, and he was a single breadwinner of the family. So he was in a very pitiable condition when he came here, and he was also medically not fit for the surgery immediately. So we put him through, and he had visited multiple hospitals, and of course they had given him a very guarded prognosis regarding his vision, and also the kind of financial burden that he would incur was quite beyond his I think imagination also. So he just came here and said, whatever is possible here in Swami's institution, let it happen. I've just come, and I have nowhere to go, and nothing, I have no other option. And so we put him through the system, and it took about a couple of weeks to stabilize him medically. And when he arrived, he seemed very desperate, very anxious, and he was most of the time sobbing and crying because he was unable to see from both his eyes. And once, we spoke to him, we counseled him and put him through the system, and he went through, got his blood sugars controlled and looked at all his vital parameters, everything was brought under control. Apart from all that happening on the medical side, the transformation that was happening as a person was very evident. He became a happier person, though with all his troubles, he still started smiling and started feeling a sense of reassurance that I have come here and there is something very great in this place. It is truly a temple of healing. There is no stress of like any other hospital. I'm feeling a lot calmer and much more peaceful here. So we generally think of preparing a patient medically for a surgery, but we never think of this aspect of preparing his mind and transforming him to heal himself better. So that is one aspect which we truly see in Swami's hospital. There is something beyond just the science. So he became a very much calmer person and went through the surgery with so much ease. And the surgery, technically it was a very difficult situation because he had this for some time. It was in both eyes, and because of his comorbidities, it was not a very healthy looking retina, and the traction detachment was quite extensive and severe. And at that time, just before starting the surgery, I just told Swami, this patient has come and he is in such a state and his eyes are in a very advanced and a very severe condition. So Swami, please, I am just an instrument in your hands. Just guide me, just help and just do the surgery through me. I think that particular surgery was just an amazing experience for me because it was a spiritual experience for me also and for the patient. The patient was absolutely calm and his blood pressure was absolutely controlled. He cooperated so well, and even during the steps of the surgery I realized that where there could be bleeding, where there could be so much more surgical trauma because of the extent of the disease, everything was as though an unseen hand was just doing the surgery for me. It was a really blissful experience. And once I finished the surgery, at that time I just had an intense desire, Swami, please give me more opportunities to work here, to serve these patients. And it was such a blissful spiritual experience for me also. And then this patient, it was such a beautiful time, the way he recovered and the way he was telling us, Madam, इस हॉस्पिटल में कुछ करिश्मा है. Something has transformed in my life. My life has become better after coming here. That was such a beautiful thing to hear because it was not just he was a transformed individual apart from regaining his sight, and he was able to ambulate, he was able to walk on his own, and he still comes very happily. And he brought some fruits for Swami's hospital for distribution also one day. So it was such a beautiful experience. So all these few instances that happened just made an intense desire and come to me saying, Swami, please give me my opportunity. You have given me this training in ophthalmology. You have made me an ophthalmologist, and you have guided me all along. Please give me this opportunity. And another instance of one of our staff, Shri Praveen Vemula, his father had to undergo cataract surgery here. So one eye was done, and we have done the surgery through the latest technique called phacoemulsification. And the next eye was also done a couple of days later. And since that, the cataract in that eye was a little hard, and there was a piece of it which was retained, we took him up for another surgery called vitrectomy. And on that very day, very surprisingly, in Swami's room, we saw Vibhuti mark appear on Swami's left eye. And the left eye was the one that had to be operated, and the operation went on so well, so beautifully. So this is just to say that whatever has to happen for the patient will undergo, but Swami gives us all the strength for the patient as well as the surgeon to go through it in the most beautiful way and come out of it much stronger and better. So, and I would also like to recall another lady who presented to us in our ophthalmology OPD with a chronic red eye. That means she had a red eye for many months, and she had been treated by plenty of antibiotic topical application, and it was not clearing. She was given steroids, but nothing seemed to happen. When she came in, and when we examined her, we felt that this is not just a red eye, not just an infection, this is something else going on. After a detailed examination and history, we suspected that this could be a condition called a carotid cavernous fistula. That means this is a fistula inside the brain, so which kind of causes congestion of the vessels, of the blood vessels in the eye, causing it to appear red. So we referred her to our neurosurgical team, and they have done the latest diagnostic procedures for her and confirmed that it was indeed a carotid cavernous fistula, and she had the high flow one, which was usually a one which is more aggressive, and the low flow fistulas are known to close on its own, but the high flow fistulas usually need a surgical procedure. So she was evaluated, and the images were all sent to us, and we all saw that the fistula was there and needed correction, surgical correction. And this is it needed some special preparation, and it was a very expensive procedure, so we had to plan for her. So we told her that we will call her back shortly. And she was she was a lady who was so devout, who always said that if whatever happens, let it happen in Swami's hospital. Whether you give me just medical treatment, surgical treatment, whatever it is, I will just take it here in Swami's hospital. So she had that kind of an attitude, and when she went back, and within a couple of months, when we called her again to come back for the procedure, she reported that she's feeling a lot better, and when she actually came, we found that her eye looked absolutely normal. There was no redness, there was no fullness which she had, and she was very comfortable. And then to our surprise, everything seemed normal, and sent her back to the neurosurgical team, and they repeated all the tests again, the entire set of tests, and then they saw that even the high flow fistula that she had closed spontaneously. So this is truly an instance of Swami's grace on the patient, on all of us. And there are instances when Swami shows us how his divinity works. So it is not just the subject, but we see the other aspect of Swami's Leelas unfolding in such a beautiful way in front of our eyes. So all these instances somehow made an intense desire within me to come and serve these patients here. And I really felt that all my training had happened for this very reason. So Swami, just give an opportunity. But at that time, in this department, the general hospital had moved to the super speciality here, and there was no post. And in 2019 April, Dr. Shekhar got an opportunity by Swami's grace to come here as a chairman of cardiac surgery and the director of the hospital. So once he moved here, my desire to come and work here intensified. And though there was no post at the time in the Department of Ophthalmology, I just wrote a letter and left my my intense prayer in Swami's room, saying, Swami, please, I would wish to serve in Swami's hospital. Please provide an opportunity. And that letter was blessed with Vibhuti, and a post was came about, and I joined here full time from September of 2019. And after having come here, since I have trained in retina, and ophthalmology and particularly retinal specialization is very dependent on very high class instruments and equipment for diagnosis and treatment. So when I came here, and there was an extra room there which was given, and I went into the room which was being used as for a different specialty at that time. So there was just a couch and a chair and a table, literally an empty room. So the day I went and sat there and just looked around, it was an empty room. It was anything but an ophthalmology department at that time. I just looked around and I just saw Swami's picture there, and I imagined, okay, the fundus camera will be here, the optical coherence tomography machine will be there, and my slit lamp and unit will be there. I just made a mental picture and said, Swami, please make this happen. And you will not believe it, dear sisters and brothers, the way things have worked out. I don't think it can happen in any corporate hospital. The speed and the sequence with which the events happened was just unimaginable. And within a span of 3 to 4 months, we had the latest equipment all given to us. We have the latest fundus camera, the latest optical coherence tomography scan, we have the beautiful unit, we have a non-contact tonometer, all the latest brand new equipment all came about within a span of 4 months, and the department was equipped to completely handle the retinal speciality. Apart from that, like I told you, we have the latest phacoemulsification machine for surgery, where we do the latest technique of cataract surgery as well as vitrectomy surgeries, and we use the top end kind of disposables and equipment just like any other hospital, and we are able to do all this by Swami's grace totally free of charge for the patient, which is, I think, the greatest boon and blessing to humanity, because once the vision is lost, lot of patients go through intense problems in their personal life. They're financially very down, and psychologically they're very depressed. So to bring them up, the vision comes back, and not only that, they get back a kind of a spiritual joy and hope, and their lives get transformed, which I think is one of the best things that we are seeing here. And to be part of that, and to be part of Swami's mission, and to serve in his institution is probably many janmas of punya that we have done to be given this chance to us. So, and another instance that I would like to remember here, just to show Swami's presence always with us, is on one day when I was in the hospital where I was working. I reached there in the morning and went up, and at that time, surprisingly, there was one of the patients who probably who was also a devotee of Swami. He just brought a small calendar picture of Swami and gave it to me, and I received it with so much joy, saying first thing in the morning as soon as I entered the hospital, I got this picture. So it was very nice. It was a very good feeling. And after that, I realized that I had left my pen in the car, which was in the basement. And I thought, okay, let me just go and get it. And as is the thing that I would always like to take the steps rather than the lift. So I was walking down the ramp, the steps and then the ramp. And there was a building which was coming up just next to our hospital, a huge, tall, maybe 3-4 floors. and there was some work going on there. There was some construction going on there. And as I was walking down the ramp, I suddenly thought, as though someone just held me in my tracks and said, "Oh, did I bring my key?" So I just stopped in my tracks for a minute, and then a huge block of concrete just came rolling down from the building adjacent and fell just in front of me. I think if I had just started, if I was moving, I would probably, have been in great danger. And then at that moment I realized that Swami came to me, someone gave me a Swami's picture for that, just Swami's assurance that yes, I am with you. It was such a beautiful feeling, and that moment I just stopped in my tracks and this huge thing just fell in front of me. So I don't know how many times I thank Swami that we don't realize how Swami is always, like Swami used to say, is with us, in front of us, above us, behind us, all the time, looking and helping us in every moment of our life. So as you see, the way Swami has got me into the speciality of my liking, my choice, and gave me all the necessary the Shakti to go through the training, to go through the retina training. And he has planned my career in such a beautiful way. And since Swami is Kalatita, he knows the time which is correct for any event to happen. So since I finished and since I moved to Bangalore in 2002, for 18 years, he gave me all the necessary training for me to be eligible to start the retina department over here and serve the patients. And that when the time is right, Swami has given me a chance, called me back, and has given me this chance to work in the hospital. So my sincere prayer to Swami to continue to guide us and make us instruments in his divine mission and help us serve all the patients who come here. And once I remember Swami told me in one of the interviews that when you see a patient, you should not just see the eye. He showed me an example. He showed me his own handkerchief. He told me, he just showed it this way and said, so if I just show you this, what will you know? You just say it's a cloth. But when I open it, you know it's a handkerchief. So you should be aware of the total person and not just see the eye. So we're trying to follow all what Swami has told and trying to see the patient as a human being and a person and help him heal himself in every way possible, not just limited to the eye. So I sincerely pray that Swami continues to bless us, continues to guide us. And working in this hospital, not just as a doctor, but our Satya Sai Institute of Whitefield Hospital campus is a total family. We are all one. And the kind of support, love, and the kind of help given by every member of staff over here is just amazing. It is a true example of Vasudhaiva Kutumbakam. We are all one family here. And Swami removes every trace of anxiety or fear or worry of any sort. And we are one happy family all together, serving, doing the excellent professional work as well as progressing on our spiritual path. And that is such a beautiful all-round development of us, not just on our professional part, but spiritual, emotional, psychological, on all respects. It's in a way a very balanced progress on our life's journey. So I thank Mano Hridaya Sai for giving me this wonderful opportunity to share my experiences at the Divine Lotus Feet. And I pray sincerely to Swami to continue to guide us and continue to keep us here to serve the patients better. Thank you all. Jai Sai Ram.